George Kilpatrick, inspiration for the nation. Love is in the air. We have America's favorite psychiatrist, Dr. Ish Major, host of Marriage Boot Camp, and it's a brand new season coming up next month, and we're so excited to hear about what the cast is going to be and what surprises we're going to have. But of course, when Dr. Ish is in the house, we've got a few things we want to get to, but y'all want to hear about relationships. I know that's what y'all want to hear about. Valentine's Day is coming up as well. And so I know that this is the must watch, must listen to interview for our listeners. Dr. Ish, good to see you as always, brother. Good to hear from you as always.
How you doing, my friend? Good to see you, man. Thanks for having me back.
Author, television personality, and all of that. So let's start with pandemic, right? We were talking before we came on the air about COVID breakthroughs and how we've experienced, we've seen it up close and personal and all of that. And so, let's take a breath. Mentally, we are all fatigued about this thing. And how have you seen it from your practice as a psychiatrist? How are you seeing this play out for folk?
Yeah, man, everybody's fatigued. Everybody's exhausted. Everybody's got pandemic burnout, COVID fatigue. I know you're getting COVID burnout and pandemic fatigue when I see you living a life of extremes, right? So you're on the one hand, on the extreme side, you got folks who are pretending like it's not even here.
Yeah.
I'm going out without masks. I'm going, I'm not, what is 6 feet social distancing? Vaccines I don't trust. Give me the horse medication, right? You're trying to live as if this is not happening. So I know you're in a state of fight, flight, or freeze. Those folks are frozen. They don't know what to do, right? They're scared, but they're scared to admit that they're scared. So the easier thing to admit is the anger. And so they just come across as angry. Then on the other side, you got folks like me who are just terrified to do anything, right? And we're at home still. The self-imposed isolation. We're very, very skittish about doing anything outside without a mask, proper precautions. And so nobody's really living the life we want, and everybody's just frustrated in the meantime. And so that's how I can tell in the general population, folks are getting fatigued. How I can tell amongst doctors, everybody's having an empathy deficit, an empathy crisis. Even the doctors are having the same thing for folks who aren't vaccinated, right?
Oh, so that's a real thing. Like, in other words, when you say empathy crisis, the physician's oath is to do no harm. Yet when you see people coming into the ER who are taking and they refuse, to be vaccinated, that's certainly you're saying that the healthcare professionals are saying, I don't know, I'm not feeling this.
They're struggling with it, right? They're going to get treated the exact same way, but it's hard to have that empathy because this is something you could have avoided, right? The vaccine's been here for 2 years. We know they're safe. They're not killing anybody, right? You could have avoided this hospital visit, this ER visit, this hospital admission, this ICU visit. We could afford, right? There's a way for you to avoid having to send that sad last video from the ICU that the nurse is holding up in your face, and you're telling somebody to please get my kids vaccinated because I wasn't, right? That all can be avoided. And so docs, a lot of healthcare providers are just they're not feeling it because this could have been avoided. And we have been trying to tell you, and we've got all these other folks who've done everything they can and they're still sick too. So, so it's a lot for everybody.
So Doc, how do we deal with this? What do we do? Because, people, Kyrie Irving, right? People have their reasons for not wanting to be vaccinated. You've got podcasts, you got Joe Rogan, you've got, who's the quarterback of Green Bay? Aaron Rodgers, you got very prominent people.
The immunization king. Yeah.
Right.
And it's at worst, it's irresponsible. At worst, George, it's like an obstinate child, right? They refuse. I'm going to hold my breath until you give me the ice cream. I'm going to hold my breath and stomp my feet until the pandemic ends. That's just not how this works, right? At best, it is willful ignorance. At worst, it is weaponized ignorance, because at some level, I have to know that what you're doing is causing harm to some people, right? And so I've got no time for the Joe Rogans and the Aaron Rodgers of the world. Wish you the best, make your decision, do your thing, but you have an audience. People listen to you, they follow you, they will do the thing you say. you've got an obligation to give them good information.
Dr. Ishmael, of course, our guest, we're talking about COVID and what's happening in the pandemic. And one of the things that people aren't really talking about, it's not just getting COVID and getting through it, it's the long haul. And you're saying to me that there are individuals who are also committing suicide because they can't deal with the long haul COVID symptoms. I haven't heard this. Talk to me.
One of the saddest stories I heard in my life, man. We had a guy on, a gentleman came on, the doctor from California last week, and his wife was a long hauler, right? And she had COVID. She wasn't vaccinated, had COVID, right? And she kind of got over it, but then she had the long haul symptoms. She had the neuropathy, the pins and needles in her extremities. She had the butterfly flutter. It feels like a hummingbird is just every hour on the hour, a hummingbird just flying around your chest cavity, right? Impossible for her to sleep more than an hour at a time. And this just kept going on and getting worse and getting worse. And one day he's going to pick, he's talking to her and trying to be the big cheerleader and say, hey, hang in there. It's going to get better. I've had stuff too. And she was like, just stop cheering for me. I don't need you to be a cheerleader. This is bad. We need to admit that. And he goes to pick up his son. And on the way home, from school, and on the way home, he's talking about, hey, mom's still not doing well. We're going to do everything we can to, to keep her in the game. And, and hopefully, she starts to turn the corner here soon. They walk back in the house. He walks into the bedroom, opens the door for, her child to say hey to her. And the husband sees her swinging from the bed. Shuts the door immediately, puts the son in the other room. Don't come out no matter what you hear. Called 911. He did CPR on her for the first 7 minutes, self-admittedly the wrong way.
Right.
And then for the last 13 minutes, the right way. And I know how traumatized he is because he knows exactly how long he performed that CPR. And I just, those kind of stories break my heart, they just do, because the long haul stuff is what we're not talking about, right? I've got a sister who's young. She lost a great deal of her hearing after she had COVID. She's got hearing aids now.
Oh, man.
Right? And so these are those things that are happening with, whether it's the neuropathy, whether it's the heart stuff, the myocarditis, all of these neurological symptoms people are having that they don't realize that could happen after a bout of COVID, your first bout, your second bout, a severe bout, or a mild to moderate bout, right? All the long haul stuff can still happen regardless of your course.
And people, so basically it's Russian roulette. You're taking a chance.
Right.
And you have, but so the mental health, right? As a result of that, you also say that because of the pandemic, we're seeing an increase in suicide in young people. And we see that Miss America, Chelsea Trist, I believe her name is.
Tragic, yeah.
Beautiful young lady, Chelsea Christ, Chesley Christ, Chesley Christ. Beautiful young lady, 30 years old or so. Correspondent, I believe, was it Extra or
Extra?
Yep.
And an attorney. Accomplished twice, 2 or 3 times around,
and leaps to her death in Midtown Manhattan.
Right.
What does this say to you about how young people are feeling and what we need to pay attention to with our youth? And that she happens to be an African-American woman, is that something we should also, not that we should also, are we seeing suicide rates increase with youth of color? That's a separate question. Let's just talk with the moment.
I think, my heart breaks for Chesley and what she was going through. You can never tell by looking from the outside in, right? Because from the outside in, she's got it all. She's living in Manhattan. She's an attorney. She's on television. She's a former, right? She's a former beauty queen. What else could go right for her, right? To just look at her walking down the street, but you never know what somebody's got going on inside from her heart. So my heart goes out to her and her family. And the kids are getting left behind, right? The group that did the worst coming out of the pandemic were our young people, teenagers and our young adults, because they were the ones who everyone assumed would be okay, right? Oh, well, COVID doesn't, have as big as effect on you physically. And so, so you don't get to be a part of this conversation. But they felt so far out of the loop that they felt forgotten. And remember, the primary thing for young adults and our teenagers is for that connection, right? They want to belong to the bigger, larger thing. They want to be a part of this thing. They kind of help drive the culture. And so it's been really, really hard on them. It really has, excuse me. It's been really, really hard on them. And we're seeing the fallouts in our hospitals. We're seeing the fallouts in our mental health clinics. We're seeing the fallouts in the therapy visits. It's a lot of kids and young adults coming in. And in particular, so to get to the Chelsea question, the African-American question, is it higher in us? I think the proportions are the same, right? We're always underserved when it comes to mental health in particular, as far as Black folks and people of color. And so those numbers are going across the board, right? The increase in the rates of depression and anxiety, also we're seeing those according increases in the rates of suicidality as well.
Yeah, and so what can we do to manage ourselves during this time as we are dealing with this, right? Because we started with talking about pandemic burnout and how this is, and how we keep, once we get around the variant, there seems to be another one, and then another. We keep. So, what is it that we can do to manage ourselves to make sure that, one, even if we don't have COVID and never had COVID, not go into a deeper depression? Now, I guess the good news is, Doc, if there is any, the great resignation, right? People are assessing their lives during this time and they're making those changes. So I'm not going to say if there's one positive thing. I did say if there was good news. So I don't want to call that good news, but in other words, people are actually doing some self-assessment and saying, I don't want to live this way. I'm going to make this change, whether it's a new employment thing or whatever it is. So that could be, is that a fallout that is going to be something we're going to watch and say, well, okay, that's an improvement over before, or so that's one. And then the other piece of it is, what do we do? How do we manage? Well,
it's a silver lining, right? Every storm has a silver lining, and this has been it from COVID. COVID has been the dark gift, right? This is the darkest gift ever. But now people are more interested in quality of life versus
quality of life,
right? I don't need all the cars and the big enough house, and right? I just want to be someplace where I'm happy, where I feel like I can show up and walk outside and breathe some fresh air and be me.
I'm gonna make a quick joke though. If they don't want about the car, stay off your Instagram page, because that's what that brother be posting. But that's don't go on his page if you, because he's still posting about cars.
But okay. I'm a car super freak. You gotta understand, right?
So let's put that in perspective, right?
Yeah. So yeah, folks are choosing quality of life, which is a cool thing. But the bigger picture is the world is changing. The environment is shifting beneath our feet. And COVID has taught us a very hard lesson on how to adjust to that shift, because this will not be the last one. This is the first big one in a series of many more to come. And so we've just got to wrap our heads around the uncertainty of the world we're living in, right? That's where we are.
How do we take care of ourselves, Doc? And then we'll go to some other questions. Yeah. How do we take care? There's a couple of things I want to do. Then we'll go to some pop culture stuff, the new show and all that. Go. Yeah.
So you got to take time out, right? You got to take a time out. If you're trying to get all the information you can every single day about COVID and figure out what to do, it's crazy making it. You're going to burn out, right? So set one day per week where you get your information, you get your latest updates from whatever source that you trust. Hopefully it's a trusted and reputable source, and not just a source that's got tons of propaganda and wants you to believe like we all believe, right? Get that one day a week set aside, get your information, figure out your game plan for the next week for you and your family to keep yourself as safe as possible, and go from there, right? The thing that helps you sleep at night is knowing that you did everything you could today to be as safe as you can tomorrow, right? These are those unintended consequences that we can't predict once you're out in the environment, and once you come into contact with COVID, those are largely avoidable, right? Vaccines are safe. Okay. The vaccine is safe. If you are older, if you have other health conditions, if you got high blood pressure, if you got diabetes, and you're walking around like this thing ain't happening without a vaccine.
Wait. So you just said what most Black folk have, right?
Right.
You said high blood pressure, diabetes, high diabetes in our community. What else did you say?
Right. And right, you've got asthma, you've got COPD because you smoke
all
your
of
whole
those
life.
things.
You've got sleep apnea, all these,
No.
right? You've got any level of obesity,
No.
which a lot of us have. You're walking around and it's only a matter of time, right? This is not a question of if I get it and get sick. It's simply when, if you're walking around unvaccinated without taking your proper precautions, okay?
Let me bring this up, Doc, because you said that, when you took the vaccine, you did feel some things as a result of that. Would you trade? So a lot of people are saying, I don't want to get sick because I took the vaccine. How do you explain to people that you were willing to take that in order to have the health benefit?
Well, people don't understand the assignment.
Okay.
Right? The assignment of the vaccine is to keep you alive.
Okay.
End of the story.
Okay.
Period.
Okay.
The vaccine was never intended to help you not get COVID. That's not the assignment. The assignment of the vaccine is to keep you out of the hospital, out of the ICU once you do. Period. End of story. Took the first vaccine, no problem. Took the second vaccine, no problem. I got breakthrough COVID, kicked my butt, had every symptom, including loss of taste for 2 weeks, but I didn't go in the hospital and I didn't go in the ICU and I didn't get dead. You know why I didn't get dead, George?
Because you had the vaccine.
Because I had the vaccine,
okay.
Right? So understand the assignment, people. That's the assignment. So the argument is, well, if I'm going to get it anyway, no, that's not the assignment. The important part that you're not underlining is you're going to get it and you're going to stay alive and go back to your life in 2 weeks with the vaccine on board.
Yeah, I want to, can I just circle back to Chesley Chris? And how we check on people, because obviously something was missed by her circle of friends. I'm not blaming them. I'm just saying, how do we make sure that we're really touching base with people and helping them to push through the things that might be overwhelming them? Because oftentimes we find that when people do take their own life, nobody saw it coming, or there might have been some breadcrumbs. So are there breadcrumbs you can share with us, Doc?
There are, right? So some of those telltale signs of suicide is first the isolation, right? They fall out of the circle. You're not hearing from them. You're not seeing them. They're kind of canceling some of those appointments and things. They start talking these very generalized, vague terms. Oh, well, life is okay, or life is just all right. Well, I got a lot of stuff going on, right? They are preparing to check out. So you unplug, right? You unplug from your family, you unplug from your social circles. You're not giving them those details of your life. You're kind of speaking in generalities. You're not reaching out as much. They're not seeing or hearing from you as much. Those are some of those telltale signs, right? Maybe whatever that numbing medicine of choice they have, whether it's television or overworking or over-exercising or drugs or drinking, they're leaning more heavily into that. So the thing you got to do, George, is you got to use what's in your hand, right? Look what I got right here. I got a phone. Send a text. Hey, just checking on you, right? But actually dial the number and hear their voice. Let them hear yours, right? Because the other thing that the thing that marks the difference between a sad mood and a severely depressed mood is that hopeless feeling, right?
Hopeless.
Chesley felt hopeless. You know how hopeless.
Even as it appeared that everything was going great.
Right. That's the outside, right? Just forget about the outside. You can't try it on, buy it on, change it on. That's the outside, right? So you know how hopeless you got to feel to walk outside a New York City balcony and look down and said, that is the best option for me, right? That's heartbreaking. So they need to know that they're not alone, right? And the way they do that is by check on your young folks, check on your older folks, and it doesn't have to be a big thing. 5 minutes, it doesn't take long.
And I guess, Doc, the reality is, if I can do all of that and somebody can still make that decision, and I need not to feel guilty about that, because a lot of the trauma, the residual trauma, what could I have done? Did I do enough? I didn't answer that text because I was busy, or I was binge watching a show and she called during that time and I didn't answer it. So I guess I don't want to prolong that, but that also occurs to me, like, how do I not carry that residual? And so what I'm hearing you say, if you did everything you could, understand that you did everything you could.
Even if you didn't do everything you could, that's not the choice you made, right?
Okay.
Survivor guilt is huge when it comes to
Right.
suicide. Why am I here? And maybe I could have done more. Maybe, well, no, you couldn't have, right? You did your part, or maybe you didn't. Maybe you didn't return that text in time or that phone call. And maybe if there was, right? You know, Jan Van Zant says it so beautifully. You know, we all have our own mountain, right? That was her mountain, right? She's responsible for climbing that mountain. She's responsible for getting back up when she starts to slide down that mountain, right? Everybody's going to be their own hero or heroine in their own movie, and we don't get to write that script for them, right? They've got to make their choices, and then they've got to figure out how to live with those consequences, or in this case, how not to. And so the survivor guilt, right? Turn that survivor guilt into survival gratefulness. Hey, you know what? Taught me something, right? I woke up tomorrow. I woke up today, so I'm going to make the best of this because I know there's a lot of folks out there who did, right?
Okay. All right. Dr. Ish Major is our guest, Inspiration for the Nation. Keep it locked. More. We're going to shift our topic and get into some good stuff. Dating season, Valentine's Day, how to make the right choice, and baby mama's drama. We'll get to that in just a moment. Inspiration for the Nation.